It is May already, but COVID still seems to be a major problem in this region, really across the state when you look at it. New York City just now going to a medium transition zone. Let's welcome back Upstate Global Health Director Dr. Stephen Thomas to join us. Thanks so much for being with us again, Dr. Thomas. Good to see you.
Good to see you, Jeff.
Well, let's try to put this in context. I think a lot of us were hoping by May we might be in a better picture with COVID. Give us an update on where we are right now with case numbers, because they seem to fluctuate day to day, but they seem to still be in that same general-ish area.
Yeah, in the Northeast, New York and New Hampshire, Vermont, and parts of Maine, we're still kind of the red part of the country right now. But the good news locally is that it seems that we've leveled off in Onondaga County and the counties that are surrounding us. We might even actually be seeing a little bit of a downturn in terms of the total number of cases. Remember, hospitalizations are going to lag behind new diagnoses by anywhere from 1 to 2 weeks. So we are continuing to see a little bit of an uptick in hospitalizations. We have just over 100 people locally hospitalized. I think there's a little bit of hope compared to the last couple of weeks.
All right, we'll take that little bit. Lots of vaccine data out there now. What's your current understanding of how these vaccines that are currently out there right now are working, especially with the variant that we're dealing with here in central New York?
Right, so highly transmissible variant that I think it's pretty clear that it has the ability to evade vaccine immunity if you've only had 2 doses of a messenger RNA or 1 dose of the J&J. So again, I've said it before, these are 3-dose and 2-dose vaccines. You absolutely have to get what they call that first booster. If you do get that 3 doses, you're still going to have reduced protection against infection, reduced protection against mild to moderate disease. But these vaccines are hanging on and are still doing a good job at preventing people from getting into the hospital, developing severe disease, and dying. But that's not for everybody. Our most vulnerable populations, so people over 60, people with pre-existing medical problems, they are still dying of COVID, even though they've had multiple doses of vaccine. That's a reason why we still have to think of our neighbor and our vulnerable family members and continue to consider wearing masks and gathering safely.
Given what you've said about vaccines, what are we seeing in terms of a possible 4th shot for people who are under 50 and not immunocompromised?
Yeah, right now I think the data is supporting anyone over 60 and anyone who has pre-existing medical conditions that could place them at increased risk. So that's obesity, heart disease, lung disease, kidney disease, diabetes. Those people should really consider getting that 4th dose. I just don't think that the data is there to support people under 60 years of age, or you said 50. I just don't think that the data is there to support younger folks or folks that are healthy and don't have pre-existing medical conditions for getting that 4th dose yet. It'll boost the immune system, but we just haven't seen that associated clinical benefit. The other reason is that I'm kind of hesitant to recommend it in that group is that all these manufacturers are actively working on developing Omicron-specific vaccines. We're testing those at Upstate right now. So I think for that latter group, we should, kind of watch and wait and see what information comes out over the next few months.
Got about a minute left for you, so I want to ask you this one. Vaccines, clearly important, testing still too. So a lot of people now are using those at-home tests. How effective are they, especially for us here, our viewers in central New York, this region with that new variant that's out there? Is the nasal swab with a home test still good? Do you need to do a cheek, a throat? What are you thinking as far as the home tests go?
Yeah, there's some interesting information out there that there might be more virus in saliva than in the nose, but I think you have to use the test how it was developed and how it was tested and how the FDA authorized its use. I think the story remains the same. If you have COVID-like symptoms and you would do an at-home test and it's positive, you have COVID. Consider yourself positive. If it's negative, but you feel okay, but you're still having some symptoms, you could wait a day or 2 and test again to see if it's positive or negative. The other thing you could possibly do is, if you want the answer right away, is you go and get a PCR test, because it's going to be a more sensitive test.
Okay, Dr. Stephen Thomas from the Global Health Director for Upstate. Dr. Thomas, good to see you again. Thanks for joining us. We'll have you back. We got a lot more questions still.
Great, thank you.